Hello, my name is Megan Eimers, and today I am presenting my theory application presentation. We learned about a handful of theories in class, so I was unsure what theory I wanted to choose for this presentation initially. That said, I decided to find an article that related to my life in some way. So, according to the CDC, 37.3 million people have diabetes in the United States, which means that over 10% of the people who live in America have been diagnosed with type 2 diabetes. Now, furthermore, according to the CDC, 96 million adults have prediabetes, which means that 38% of United States adults have prediabetes. And my grandpa had prediabetes before he passed away a few years ago, and so that's why I wanted to find an article that focused on prediabetes because it relates to my life in some way. So after researching and selecting specifically the social cognitive theory, I chose an article titled Social Cognitive Theory-Based Intervention to Promote Physical Activity Among Pre-Diabetic Rural People, a cluster randomized controlled trial. So the authors of this trial were Tahera Shamazadeh, Laila Jahangiri, Parvin Sarbatshka, and Cohen Pone. So now, just like a brief outline of what I will be talking about today. So, to begin, I will review exactly what social cognitive theory is and dive into why this study was done and some terms that I think are important before kind of diving into the methods and results of this study. Then I will share the research question used to perform this study, as well as the methods and design of how this study was done. Then I will illustrate the main findings this study showed and share the strengths and the weaknesses that I see or I saw in the study. And then I will end with the conclusion, kind of summing everything up really briefly of what I had discussed thus far. So, to begin, some background. Before going into the research questions and the design, I do think it's important to define some terms that I will be mentioning in this presentation. Prediabetes, as it is defined in this article, is the idea that, quote, one's blood sugar is above the normal range, but not high enough to identify the case as a diabetic. So basically, people have elevated blood sugar outside of the normal range, but that elevation is not high enough to constitute a case of type 2 diabetes, but those people are likely to be diabetic if that is not changed in the near future. So another thing I thought was important to address before going into this article is that this article is based in a rural area. And you might be thinking, why? Why do they care about rural areas? Well, rural areas often have higher rates of diabetes, and this article lists a variety of factors of why that might be the case. So some of these things are lower socioeconomic status, longer commutes to get to doctor's offices and other healthcare facilities, lack of access to healthy, affordable food, and long distances to workout facilities, walking paths, and other areas to exercise. Next, I want to address what physical activity intervention, or PA, is. Physical activity interventions aim to increase the individual's exercise weekly goal to get to 150 minutes of moderate exercise per week. And then lastly, social cognitive theory. We learned a lot about it in class, but some things that I'm going to address in my article today specifically are why it's used in this intervention, and that's because this intervention, there is an important relationship between the individual, the environment, and the behavior. So the individuals live in an environment that is rural, and the behaviors they have, such as how often they're exercising, what they're eating, they all relate together. So that's kind of one of the reasons I chose to look at this article. And this study focuses on behavior change, and we learned in class, and I learned through this article, that self-efficacy is essential to effectively changing the behavior of an individual. And once I get to the results section, I kind of talk about self-efficacy a little bit more in detail, so I wanted to kind of go over this. Furthermore, as we learned, and as I learned in this article, goal setting is another important part of the social cognitive theory, and it is also an integral component in changing a person's behavior. So now going into the research question. So there's not been a lot of information on the effectiveness of physical activity interventions on pre-diabetic patients, especially in rural areas. Therefore, as noted in this article, quote, the study was designed to assess the effect of social cognitive theory based physical activity intervention on pre-diabetics in rural areas of Bihar, which is surrounded by many small hills. Rural communities often lack walkable environments, environmental features such as parks and greenways or gyms and fitness facilities for physical activity. So now going into the research methods, this is a randomized controlled clinical trial. It happened in Bihar, Iran. The sample size was over 100 patients for both the experimental and the control group. So on the right here, we have a little kind of display of the methods, like a flow chart of the methods that was present in the article. It is figure 2. So basically it was random. On the left you can see the intervention or experimental group, and on the right is the control group. So real briefly, they invited people to this study from 6 rural health centers. They had to do a fasting blood sugar test, and they excluded people who either did not do that test or their measurements were outside of the range. Then they looked at baseline measurements and excluded people that no longer wanted to be part of the study. Then they did the allocation process and assigned people to the intervention group in the in the control group. The experimental or intervention group did the physical activity intervention, and the control group kind of did not. And then 16 weeks later, 4 months later, they followed up. So the main findings of this study, again, I wanted to do show this chart because I think it's the most clear way to show this. So basically, the study found that the experimental group, which went through that physical activity intervention, had significantly lower fasting blood sugar, BMI, weight, and diastolic blood pressure post 16-week intervention. So we can see this on the left side of table 2 under the intervention category. We can see an increase from the baseline to the after the 16 weeks. So BMI went down, fasting blood sugar went down, weight went down, and diastolic blood pressure went down, and that is those were all significant. Now, when looking at social cognitive theory, there were also a lot of differences, specifically with planning and coping self-efficacy. As we can see here, it went from 5 to 5.95, and then with goal setting, it went from 2.1 to 3, as we see here. And so this shows that there was a significant improvement in these social cognitive theory factors in comparison to baseline and after the physical activity intervention 16-week trial. So then going into the strengths and weaknesses of this trial, basically the strengths were that they studied a population that had not been previously studied, so that could add to this research, and interventions like this have the capability to help a lot of people, especially in the United States. Some weaknesses of this study: it's hard to compare because there's minimal amount of studies testing the same thing. So here we see that a strength can also be a weakness, and that rural population was the population of interest, so it was hard to know if the study can be generalizable to other rural communities or even more so urban communities and suburban communities. So in conclusion, basically this research study aimed to see if pre-diabetics could go through physical activity intervention to kind of decrease their susceptibility to diabetes. And they found that yes, the physical activity intervention was successful, and a lot of the social cognitive theory factors also increased through this trial. The strengths and weaknesses, basically, it was really important, and it's kind of leading its field in the research, but a lot more research needs to be done. Specifically, this study was done in Iran, and so more studies like this in the United States would kind of help us understand how this study would look in the United States. So overall, this was a highly effective study to reduce the risk of developing diabetes in rural communities in Iran.